Welcome to Unrivaled Care. I'm Janelle Reilly, CEO of the CHI Memorial Healthcare System. Imagine flying in a helicopter over a busy city. As you look out the window, you can see a network of highways and exits, all flowing seamlessly. Your circulatory system, which consists of all the arteries and veins that are essential for moving blood throughout your body, can be thought of in that way. And just like a traffic jam can quickly stop the flow of traffic, a blood clot or a plaque buildup can restrict and even block blood flow, disrupting the entire system. Some of these conditions can become problematic and result in serious complications. Fortunately, there are minimally invasive and full reconstructive procedures that can restore that critical flow. Dr. Fugate is a board-certified physician in vascular and general surgery. He's certified in advanced cardiac and trauma life support. Dr. Fugate has practiced vascular surgery at hospitals in Chattanooga, Tennessee since 2009 and has served as an associate professor in the Department of Surgery at the University of Tennessee College of Medicine in Chattanooga. He delivers unrivaled care right here at home. Dr. Fugate, thanks for joining us today.
Thank you, Janelle.
I thought we'd start with just a couple of quick questions. First, if you could just share with us a bit of your background and how you became interested in medicine and how particularly you became interested in vascular surgery.
So this goes back probably a little further than you would want, but I grew up on a farm. I was the youngest of three boys, and my dad is actually the one who steered me into medicine. There's nobody in medicine in my family, so my two older brothers had gone down paths that were leading them away from the farm, and I announced to my dad when I was about 14 that I was going to stay on the farm with him because that farm has been in our family for over 200 years, so it seemed important to me to kind of carry on the legacy, and he sort of nipped that in the bud, so to speak, very quickly and told me that I should be a doctor. So that's how it started. So beyond that, my intention began as the goal of being a family physician in a small town, and then when I got into medical school and started my clinical rotations, I fell in love with surgery, so then my plan was to be a general surgeon in a small town, and then as I got into surgery residency in North Carolina and experienced vascular surgery for the first time, then there was never really anything else I seriously considered. Part of it was good mentors. The surgeons that I worked with, I wanted to emulate, not just professionally, but personally. They were good guys and they were fun to be around. But the satisfaction of vascular surgery to me is unrivaled because there's serious problems that when you address them, you know right away if it's fixed, and I like that. So the sort of immediate results and the sort of dramatic results that it can make in people's lives.
Oh, awesome. Well, thank your father for us, for steering you this way.
Well, I don't want to give him too much credit. It'll be bad for his ego.
Okay, but thank you, and thank you for bringing your talents here to CHI Memorial.
Absolutely.
So very, very exciting for us to have our new vascular surgeons here at CHI Memorial. So can you just walk us through really the spectrum of services that we offer and the conditions that your group treats?
The way I like to describe it to my patients, which is a good starting point here, is we treat disorders of all of the arteries and veins in the body outside of the heart and outside of the brain. So everything else is our territory. As you mentioned in your introduction, most of what we deal with is atherosclerosis or plaque buildup in the arteries. So we deal with blockages as you described, and that can be in the carotid arteries very commonly, in the arteries of the lower extremities, in any of the arteries to the kidneys or the intestines or any of the vital organs. So we deal with blockages a lot. Another thing that we treat commonly are aneurysms. So if blockages can restrict blood flow and make the arteries too small, aneurysms are when arteries are too large. So aneurysms can be life-threatening, and they're typically silent or asymptomatic. So we diagnose and treat aneurysms as well. We treat venous disorders, whether it's deep vein blood clots or sometimes superficial venous insufficiency, which a lot of people will recognize as varicose veins, but sometimes can be more serious with venous ulcers. We treat patients on hemodialysis, so we provide a lot of access options for hemodialysis for the dialysis population. I think that may cover it. There's probably some other less common things, but those are certainly the more common ones.
Okay, as part of the circulatory system, both vascular and cardiac surgeons focus on treating blood flow blockages, but what's the difference?
So you pretty much nailed the difference in the specialty names. So the cardiac surgeons and cardiologists deal exclusively with the heart, and whereas we deal with all the arteries everywhere else in the body. A lot of the techniques are very similar. So people who get angioplasty or stents in the coronary arteries, we use the same type of technology in arteries in other parts of the body with angioplasty or stents. And then the way that cardiac surgeons will do bypass surgery for some people with heart disease, we will do bypass surgery in other parts of the body. So like I said, the techniques are the same, but what makes it different is the different anatomy.
Okay, it's the locations
in
the body, and as you said, the different parts of the anatomy. We're proud to be offering really unrivaled care here in this community in Chattanooga and in the surrounding areas. How have you seen that care has developed into what it is today?
One of the things I didn't mention earlier about vascular surgery that draws it to me is it's a heavily reliant specialty on technology. So there's been a lot of technological advances both since I started the journey in medicine to vascular surgery, but even since I've been in practice for the last 13 years. So the trend, without getting in too much in depth, has been from more invasive to less invasive. So we do many more things now that are less invasive, that are often outpatient procedures, whereas in years gone by, treating those same problems would require lengthy hospital stays and long recovery. So I would say that's been the biggest sort of evolution of the specialty in vascular surgery. And then in our community, I think the thing that has changed the most is really access. Part of that is due to the healthcare system. Part of that is due to what we have tried to do in educating physicians in the area, but patients as well. So outreach is a big part of our practice. We have locations in other communities outside of Chattanooga where we try to get as close to the patients as we can, understanding the difficulties in transportation and follow-up for a lot of our folks.
Yeah, that's wonderful. So technology helps evolve the practice, which helps with reducing length of stay and time in the hospital, and then the outreach to improve access. Very, very important. Okay. Can you talk about some of the common conditions that you treat in your vascular practice and what some of those symptoms are?
I would say the most common thing that we encounter on a day-to-day basis is peripheral arterial disease. So when we talk about peripheral arterial disease, specifically we're referring to blockages in the arteries in the legs. That can range from a full spectrum of no symptoms, so clinically silent disease, all the way to limb-threatening disease. So advanced stages of peripheral arterial disease end in amputation. So when we evaluate patients with peripheral arterial disease, our goal is to keep them as far to this end of the spectrum as we can, as long as we can, and away from the amputation end of the spectrum. So we deal a lot with patients that have what we call critical limb ischemia. So patients who have such compromised blood flow to their feet and lower legs that they have non-healing wounds or they have gangrene. So those symptoms are pretty obvious. You know, if you have a wound that won't heal or discoloration of that magnitude. The sort of earlier onset symptoms, what most people notice is pain in their legs when they walk. So that's usually what generates the trip to the urgent care or trip to the primary care physician. Patients experience pain when they walk. They have to stop to rest for the pain to go away, and then they can walk again. We call that claudication. So that's usually when we see the patients. Unfortunately, we still have a lot of patients who present very far to the other end of the spectrum where they are already in an immediate limb-threatening situation. So that's probably the most common condition that we encounter. But like I said, atherosclerosis can happen in any artery in the body. So probably the next most common would be carotid artery disease. One of the dangerous things about carotid artery blockage is it doesn't cause symptoms. So there's nothing that can tip you off that you have a blockage in your carotid artery unless you have some sort of imaging study, which is usually an ultrasound. So oftentimes people first present with carotid artery disease as a stroke. So that's why we try to screen appropriate patients for carotid disease. Our primary care doctors and cardiologists in the community do a good job of that, and so we get to see a lot of people before having strokes. But now that we have a stroke center here at Memorial, we see more and more people after the stroke. So that's a big part of the education, both in the patient side and the medical community side. Aneurysms, particularly in the aorta, are another very common thing that we treat. So like we talked about before, aneurysms mean that the artery, in this case the aorta, is too large. And that's another area where technology has just dramatically changed the treatment and the outcomes. So prior to about 20 years ago, the most common procedure for aortic aneurysms was a very invasive, somewhat high-risk open surgery. Those patients would often spend a week in the hospital and 4 to 6 months recovering. But now we treat those patients with a minimally invasive stent-based surgery that requires a one-night stay in the hospital and typically about 2 weeks recovery. The risks of all mortality or death associated with those two procedures is dramatically different. So it's been a huge benefit to be able to offer aneurysm repair to people who, in days gone by, would not have been candidates because of how risky the surgery was. In other sort of common things that we treat, I mentioned earlier, blockages in the arteries that go to the kidneys that can lead to uncontrolled hypertension. Sometimes it can lead to renal failure or kidney failure. Those blockages we typically treat nowadays with minimally invasive procedures like we talked about with the angioplasty or stent. Same thing with the intestinal arteries, probably a little less common, but we see quite a bit of it in our area.
So how does one go about preventing those conditions?
So that's the mainstay of all cardiovascular disease. That's the thing that most of our focus should be on is prevention. So where we live, we're just sort of predisposed for these problems, unfortunately. The Bible Belt is also the stroke belt. The Bible Belt is also the atherosclerosis belt. So our historical eating habits, bad diet, we still have a lot of people that smoke in our community. So smoking is the #1 risk factor for all of these problems. So if you smoke, don't smoke. That's kind of the first message to all patients. Everybody wants to know what medication they should be on that will help prevent these problems, and I always tell them that no amount of cholesterol medicine or aspirin will do as much benefit as stopping smoking. So that's #1, is no smoking. We also have a lot of diabetes in our areas, in this community and throughout the Southeast. So diabetes is another independent risk factor for all atherosclerotic disease. So diagnosis and prevention and or treatment of diabetes ends up being a very big thing. And then you have the more common things that people think of with the high cholesterol, high blood pressure. So those are the 4 big things that I try to focus on with my patients, with smoking being at the top.
Smoking #1.
Yeah.
Oh, very good, very helpful. In order to provide industry-leading care, our providers have to stay up to date on the latest research and the latest technology and latest innovations. What are some of the services that you're excited about that you'll see coming to our market soon?
Well, one of the things that I am most excited about, one of my passions is aortic surgery. So I really enjoy aortic surgery and have enjoyed making that a big part of my practice since I've been in Chattanooga. So the problem, I shouldn't say the problem, one of the challenges with aortic surgery is when you get into the part of the aorta that has major branches. So in other words, in your upper abdomen, where your aorta enters the abdomen, branches that go to your intestines and to your kidneys are right in that location. So if an aneurysm involves that part of the aorta that has branches on it or is very near those branches, it becomes very challenging. So there's not been a perfect solution that's minimally invasive for those types of aneurysms. So what we have been doing over the past few years has enabled us to treat aneurysms still in a minimally invasive way without a major open surgery, but to be able to deal with those important branches. So being able to repair the aneurysm, but still preserve blood flow to those branches. So that's sort of the most exciting thing that's going on from my perspective right now. And that's something that is very new. We've been doing that for, like I said, about 3 years now, and it's becoming more and more common. In fact, we're becoming more of a referral center for that from places around the Southeast, so that's exciting to see. There's always innovations in the lower extremity parts of the peripheral arterial disease, whether it's new devices or new drugs that are used to help make these interventions last longer, because that's always the problem with atherosclerotic disease and procedures to address it is it always returns. So I always tell my patients that I can open your artery, but I can never make it normal. So a lot of times we look at blockages in arteries as sort of it's almost like the analogy would be for a cancer treatment. So you can get your cancer in remission, but it may come back. So that's where the risk factors that we talk about come into play, especially. One other thing that I'll mention, because like I said, we do a fair amount of dialysis access for renal failure patients. There is a new system whereby you can create what we call a fistula or a shunt where people get dialysis, and you can do that in a non-surgical method, which is very new. So it's a percutaneous fistula creation. So that, we haven't started up that program yet, but that's on the horizon. So that's sort of the three big things that I would point out.
Oh, that's very exciting, very exciting. Hey, Dr. Fugate, is there anything else you'd like our audience to know or any final thoughts to share?
I think the message for this, at least from my perspective, is what we're able to offer from a vascular surgery standpoint really is unrivaled in my opinion. And what I mean by that is you can get care for all of these problems here. Most patients don't like to travel even across town, let alone to another town to receive high-level care. And we pride ourselves in really treating pretty much everything. It's very uncommon for us to send someone out of town for something that we don't offer. So that's a point of pride for us in our practice, and hopefully that will continue to be that way forever.
Excellent. Well, thank you, Dr. Fugate. Thank you for providing unrivaled care, and thank you for sharing your knowledge and your talent with this community. We really appreciate that very much.
Thank you.
And thank you all for joining us on Unrivaled Care.